All right, so welcome to this video. I wanted to explain here everything you need to know about dental extractions, or perhaps the most important things that you need to know. And obviously, after this video, you're welcome to ask any questions you may have about any of these points so that you make sure that you understand what dental extractions are, what options there are for replacing missing teeth, as well as what sedation options you may have to make your experience a positive patient experience. So let's go ahead and start. So as you see here, a lot of times we extract a tooth because the tooth becomes not salvageable. A lot of times it is because of decay that forms in and around the tooth that makes it difficult to treat or of a hopeless prognosis. When the tooth is difficult to treat or with hopeless prognosis, then extractions becomes a viable option. As you see here, as decay goes deeper into the tooth, it creates an abscess, and the abscess makes the tooth of somewhat of a hopeless prognosis, not all the time, but in most times. But also, abscesses do resorb the bone that is supporting a tooth, which then makes it problematic because if we have a tooth that has lost bony support, then that tooth becomes of poorer prognosis and doesn't hold on to much value moving forward. So extracting the tooth at the most opportune time becomes a very good idea. Beside dental cavities that could lead to abscesses that eat into the bone, uh, gum disease also does the same thing. Gum disease is a condition whereby inflammation around the tooth into the gum starts eating into the bone. And so the bone resorbs with time. And as it resorbs with time, not only the inflammation is very bad for the health in general because it causes cardiovascular disease, it also causes a brain inflammation and an inflammation in the body in general because bacteria do migrate into the bloodstream and they go to the rest of the body, which when we extract a tooth that has a hopeless prognosis because of the gum disease, usually inflammation goes down. I've had many stories of patients who had received extractions because of gum disease and they go back to their primary care physician, to their cardiologist, and they see that their numbers actually get better. Their condition gets better just by virtue of taking the teeth out. So moving forward, the next reason why extractions may become necessary is if the tooth cracks. As you see in this picture, there are many types of cracks. There are superficial cracks, there are cracks that extend into the root of the tooth, and there are cracks that are solely within the root that are very hard to diagnose, but they cause issues. They cause pain, inflammation, infection, and when that takes place, then extraction of that one tooth becomes a viable option because these teeth, or this picture here showing the crack, is a hopeless prognosis of the tooth, and so extraction becomes a good idea. Now, this is what extraction is going to look like. But before we go into extractions, let me explain some options that are available depending on your case. That's why an examination of your case and the possibility for salvaging or treating the tooth may be possible depending on your case. So let's go ahead and check what options could be available depending on your each case. So as you see here, these are decays that take place within the tooth. And depending on how deep the decay is and what location it is, we may have different symptoms. As you see, most of these stages are not painful, but as we go deeper, then it becomes fairly painful to very, very painful. Patients present to the clinic with a lot of swelling sometimes because they had waited too long. A lot of times when a tooth is salvageable because the decay is superficial or moderately deep, we can do what's called a root canal therapy. Root canal therapy essentially treats the decay, but also treats the pulp of the tooth so that inflammation subsides or stops, and then we can retain that tooth. To do that, we have to receive what's called a root canal treatment or root canal therapy and fill the roots and fill the crown with a filling, but also give you a crown on top of that tooth. Because once we treat the tooth, the crown itself gets dehydrated and a lot of times becomes much more prone to fracture. To prevent that from happening, what we end up doing is fabricating a crown on top of that tooth to protect it over time. In this type of treatment, and again, your case will be unique, and so it has to be treated accordingly. If you go the route of this root canal therapy, a post core, this is a post, which is a small little screw that goes into the root to hold the filling, and then a crown on top. All of these are expenses that layer on top of each other, where you're essentially paying for the root canal therapy, the post core, and the crown in order to salvage a tooth. And sometimes financially, it doesn't make much sense to go through all of these expenses when you can actually take the tooth out and replace it with a dental implant. So let's move on right now to another way of salvaging the tooth if the tooth has gum disease. As you see here, these are the stages of gum disease. Healthy gums and healthy teeth have plenty of bone surrounding them and no inflammation. And then it goes to gingivitis, which is a mild inflammation that could be treated non-surgically, and that allows the tooth to remain in the mouth because the bone has not been touched by the inflammation. When we go to the periodontitis, which is a slight, moderate, or severe periodontitis, is an inflammation of the gum tissue that now is causing bone loss. When we have bone loss, the teeth become slightly mobile. They also become somewhat painful or at least uncomfortable. During chewing, during speaking, they may cause sensitivity to cold because there is exposure of the roots of the tooth, which then causes sensitivity. And in these cases, extraction may become necessary. It's not necessary to do extractions in these two categories, but it will be somewhat necessary to do extractions in these categories. But if the tooth is salvageable, we do what's called a gum disease treatment, which is a surgical procedure that does involve opening the gum tissue, cleaning the tooth, the roots themselves, cleaning the bone from the infection and the inflammation, and then closing the gum on top of the tooth. As you see here, this therapy is generally very successful. However, when we do this type of therapy, patients usually complain from residual sensitivity because even though the gum tissue is now healthy, the root here is exposed, which then causes sensitivity to cold and hot, but also patients do complain from what's called black triangles. And these are spaces that form in between the teeth because the gum tissue, even though healthy now, has receded. And that recession becomes a generalized recession, depending on the case. And that causes an anesthetic presentation of the smile. Some patients also complain of shifting teeth. And shifting teeth is not necessarily a result of this therapy. Shifting teeth happens because the tooth has lost, due to inflammation, has lost bony support. So it becomes weaker and it doesn't necessarily stay in place. So when you eat or speak, that pressure that's exerted upon the teeth makes it shift over time. And patients sometimes mistakenly think that their teeth are shifting because of the surgery, and that's not necessarily the case. The teeth shift because of the loss of bony support that takes place once inflammation takes place. But this, in cases where your teeth can be salvageable, this potentially could be an option for you. Let's go to the next reason, as we spoke about earlier, which is a fracture of the tooth. Most times, the fracture falls in one of these categories. And depending on the type of fracture, uh, treatment can be possible or extraction becomes necessary. So if the fracture can be salvageable, then what we end up doing is essentially a surgical procedure that aims at identifying to what extent the fracture is taking place and how we can treat it. So we numb you up, we take impressions, we precisely remove the fragment of tooth that has fractured, and then we prepare for an impression to finally fabricate a crown that fits on top of the root. A lot of times this fracture is not hard to it is not very easy to identify, and so the extent of it may require a surgical entry. It is called exploratory surgery in order to be able to identify to what extent there is a fracture and how we could possibly treat it. Most times when the fracture seems shallow, but it's actually not shallow, it goes all the way down, then extraction becomes necessary, even though we have planned to possibly crown the tooth instead of extraction. But during the procedure itself, we may realize that a crown is actually not possible, in which case we'll have to do an actual extraction. So how does extraction work? Let's go ahead and look at the actual physical action that we need to do. We essentially, it involves dislodging the tooth through different movements that usually translate as a pressure in the mouth, not necessarily pain. You should not be feeling pain. You should be feeling pressure in your skull, pressure in your head, pressure in the jaw, but not necessarily pain. So if you have pain, you will raise your hand, will stop, give you more anesthesia. But if you have pressure, it is part of extracting the tooth out. Now, let's talk about bone grafting for dental implants. Bone grafting is a substitute of bone that comes from cadaver bone of donors, just like you and me. If you decide to become a donor and you're a healthy individual, your bone will be processed to be used in multiple surgeries, not just dental surgeries, orthopedic surgeries, spine surgeries, dental surgeries. All of them qualify for this type of bone that essentially is placed within the socket to preserve the socket. In fact, it's called socket preservation technique, which then prevents the socket from resorbing completely. And I'll show you why this is so important. Look at these two examples where in the upper row here, the socket was not preserved. And when the socket was not preserved, with time, teeth surrounding the socket will shift to fill in the gap. And this is very problematic because, as you see in this first picture, the contact between this tooth and this tooth is somewhat tight. And as you see here, the contact has opened, and that leads to food impaction in the area, and it leads to gum disease, it leads to inflammation, it leads to bone loss, it leads to discomfort throughout the day because you have food that's now getting stuck in between your teeth that you didn't have before. Also, when the teeth shift in that space, now the space available to replace with the missing with a dental implant down the road becomes minimal. And at times, it's so extreme that we cannot replace that space with a dental implant because now the space is not available anymore. And to treat this is very much of a headache. It's extremely expensive because you will need braces to essentially put back the teeth in their place in order to be able to receive a dental implant. However, on this side, you see that once we do the bone grafting procedure, we prevent the resorption and the movement of the teeth by placing bone grafting in the area. And I want you to check here out this out here. This ridge, do you see that it's thinner than this ridge? That means that without bone grafting, the ridge that is the place where the tooth is missing becomes too narrow in multiple directions to house a dental implant. Versus here, you have all of this width that is a good solid bone that maximizes the chance that you will be able to receive a dental implant without addition of bone or an additional bone graft at the time of implant placement. So let's recap. If you do not do bone grafting, you are in a position where teeth shift, spaces open, but also the space of the missing tooth collapses, in which case you may not be a good candidate for dental implant down the road. So you lose that opportunity. If you do bone grafting, this space is maintained. It's only maintained for what we call a sweet spot of 3 to 6 months. So within 6 months, you need to replace this missing spot with a dental implant so that the teeth do not start shifting again. So this bone grafting only holds that space for just about 3 to 6 months, within which you need to receive a dental implant. Let's talk about platelet-rich plasma. What is this therapy? This therapy is essentially an extraction of growth factors that is, these growth factors are derived from your own blood. So we take your own blood and we essentially separate the red blood cells from the white blood cells from the plasma. This fraction here contains growth factors that help in so many areas of health, including dental surgery. It helps in facial rejuvenation. If you heard PRP with microneedling, injection of PRP, it helps in hair regrowth, it helps in orthopedic rejuvenation, as well as dental surgery. And the way it works is that we have to take some of your own blood on the day of surgery, and then we go ahead and put it in a centrifuge, which is a machine that essentially centrifuges out and separates these fractions. And then we take this part that has all of the growth factors that we're going to be able to utilize, and it looks like this. This is a concentrate of growth factors that is derived from your own blood to help with the healing of the extraction socket. When we do this therapy, we can mix it with the bone grafting, and essentially what it does is that it lowers the inflammation, it lowers the possibility of infection, it accelerates or speeds up the healing of the socket and prepares you for a dental implant down the road. So now let's move on to what type of sedation therapy you could receive during the procedure so that it makes you have this procedure in the best circumstances possible and gives you a positive experience. In general, there are four main ways to give you sedation for this type of procedure: the general anesthesia, the deep sedation with IV access, the mild to moderate sedation, and the nitrous oxide sedation. These four modalities of sedation are all a possibility, and depending on your case, whether you need one extraction, multiple extractions, or wisdom teeth extractions, we will choose one out of the four to be able to give you the best positive experience that we can. Let's keep in mind that only nitrous oxide sedation, which is a gas and a type of sedation that is very safe. It's delivered to kids. It's called a laughing gas. Is the only one that does not require an escort to come pick you up after the procedure. So this is a type of sedation that is most likely to be administered in cases of emergencies where you come alone to the office and there is no one to come and pick you up. Then we give you nitrous oxide sedation so that you can relax throughout the procedure and have a positive experience. Some of the advantages of nitrous oxide sedation is that they don't cause gag reflex. They relieve anxiety and fear. They also make you not feel the needle just as much. They have a very relaxing properties, and they do relax a very powerful tongue. A lot of patients have a powerful tongue that resists dislodgement or that resists displacement, and that makes the procedure that much more complicated. But by receiving nitrous oxide sedation, the tongue relaxes, so we have a much easier procedure overall. It also relaxes most of the muscles in the body and the joints as well, including the jaw, which then allows you to have much less discomfort and pain during the procedure, but even after the procedure itself. So now we're done with the actual extraction itself. During the healing time, what are the options that we have to replace that missing tooth if we have to replace it? Remember, we said that after dental extraction and after bone grafting, the sweet spot is after 3 months and before 6 months. So between 3 and 6 months is the sweet spot where we need to receive ideally a dental implant. And if we don't receive a dental implant, what ends up happening if we wait too long, as you see here in this pictogram, the teeth will shift into that space, both the teeth adjacent to the extraction socket, but also the upper teeth will also shift. And if they shift, the contact point between the teeth will essentially become not ideal, and that causes decay, it causes inflammation in the area, and it becomes a very difficult problem to fix down the road because all of these teeth around that space have moved. So orthodontic treatment becomes an option, and that is also unpredictable sometimes and also costly and requires a long time. So your best bet is not to wait any more than 6 months and any less than 3 months. So the sweet spot is after 3 months and before 6 months for you to avoid this situation. So let's discuss the final, perhaps ideal solution to replace that missing tooth. This is a dental implant. Dental implants are screws that are screwed into the bone, and I'll have a complete separate video to speak about this solution. But this, in general, is the most ideal solution possible nowadays. And they replace one missing tooth, but also multiple missing teeth if necessary. This is one solution, but there are other solutions that we could use in the meantime. Let's imagine that the missing tooth is in the front and you cannot stay without a tooth for 3 months while you're waiting for this implant surgery. Then you are a candidate for other alternatives that could give you your tooth back in the meantime. And these options, while you're healing, could be either a removable option that replaces one tooth and has parts of essentially hooks that hook onto the adjacent teeth for you to replace that missing tooth temporarily. Let's remember these options could also potentially be permanent solutions if you are not a candidate for dental implants for one reason or another. Obviously discuss your case with me so that we can identify what options are best fit for you down the road. But this is one option that is a removable appliance. Removable appliances look like these. Depending on the number of teeth you're missing, you will have a certain removable appliance that restores these teeth either temporarily or permanently if you are not a candidate for dental implant. But if you are a candidate for dental implant, then these solutions are only temporary solutions. In the mouth, these solutions would look like this. Obviously, we're stretching the tissue here so you can see the part that is a fake gum, but the tooth itself that you see here is the replacement that you have in the meantime while you're waiting for the dental implant to be placed. You see, in these cases, these three teeth are a replacement of missing teeth, but they look very aesthetic. They are really an aesthetic solution that does replace missing teeth in the meantime. Obviously, if you're not a dental candidate for dental implant, then this solution could potentially become a permanent solution for you. Another alternative, if you decided that you are not comfortable with a removable appliance, a removable solution, there are solutions that are a fixed solution. This solution is called a Maryland bridge. This is essentially a one unit Maryland bridge that essentially is made of a tooth replacement, but also wings that are attached to the tooth that will attach to the adjacent teeth in a temporary manner, but it is fixed in the mouth. In other words, it doesn't come off your mouth unless we take it off in order to place your implant down the road. This is only for patients who really cannot deal with something removable for one reason or another. Let's look at how that looks like. This is the tooth that we replaced, and you see that it really is seamless and it doesn't look any artificial. It looks very pleasant and it looks very aesthetic, even though it is a replacement tooth. Obviously, this solution, we're going to look at the fees. If you stay without any replacement of the tooth, which is a free solution because you're not essentially buying any product, a lot of patients elect to do this because it's only a waiting time. They know they will receive a dental implant and they're willing not to spend the money to have a replacement while they're waiting for that implant to take place. So a lot of patients actually do elect not to receive any solution in the meantime, so that they don't have to incur additional cost unnecessarily, and they're not too concerned about their appearance. But every patient is different, and depending on your case, you may elect to receive a removable solution to replace one tooth, a removable solution to replace multiple teeth, or a Maryland bridge, which is usually the most expensive solution, even though it's temporary. Again, let's also remember that if you're not a candidate for dental implant, any one of these temporary solutions could become a permanent solution for you because you're not a candidate for dental implants. That sums up the extractions, the alternatives, the options, as well as the protocols. Please ask me during your examination to see what options you qualify for and how to go about your treatment. And I hope this video was helpful. Take care.